Hi, I'm Andrew Moshfeghi, MD, and I'm at the ASRS annual meeting in Montreal, Canada, where I had the opportunity to share our data looking at real-world outcomes of patients undergoing intravitreal anti-VEGF therapy for neovascular AMD, and looking at the impact of treatment gaps or treatment non-adherence in patients undergoing this therapy. Our definition of a treatment gap was a patient going more than 180 days without exposure to intravitreal anti-VEGF therapy. And we looked at the Vestrum Health database, which is a database shared by retina physicians across the United States in multiple different cities and practice types. And this was over a 7-year period of time. And what we found was that there was as many as 40% of patients at the end of the first year of therapy in these treatment-naive patients who were already experiencing a 180-day gap in their treatment. And then that subsequently sort of dropped off in a linear pattern over the ensuing 7 years, such that by the time year 7 rolled around, as many as 80% of patients had a treatment gap or treatment non-adherence of at least 180 days. What we found was that, not surprisingly, the mean number of injections per year started off around 8 injections per year and then trailed down to about 6 injections per year by year 7. Not surprisingly, these patients also had a drop in vision over time. And so it just underscores the fact that when we look at those who were not having that treatment gap versus those who were, the patients who did not have the treatment gap had more favorable visual outcomes than the patients who did have the treatment non-adherence gap. And so staying on therapy results in better visual outcomes. One implication of this study may be that if we have newer drugs that last as long as 180 days, where we're seeing so many of patients in the real world already having such a gap, then we'll feel much more comfortable about those patients not losing vision, maybe holding on to better visual outcomes in the long term. The most surprising thing that we found was in the first year. I mean, a year's only got 365 days, and we identified a treatment gap being 180 days or more. And as many as 40% of patients in the first year were already experiencing that gap. So we were kind of surprised to see it so soon. You know, we've had exposure to anti-VEGF therapy now for about 20 years, and this is not a new problem. But despite the fact that we have multiple studies similar to this one showing more frequent injections results in more favorable visual outcomes, these are still the treatment patterns. It's not that the doctors aren't recommending more frequent treatment. It's just that there's a lot of factors that result in barriers to patients being able to execute on the recommended follow-up visits, such as the fact that, you know, these are elderly patients. A lot of them can't drive anymore due to their vision or other health problems. That means they're relying on a family member, loved one, or a caretaker to bring them into their appointments. That's costly and time consuming. Each one of these appointments can be 2-3 hours in duration. It's one thing to have someone, you know, take you to an appointment and then 15 minutes later you're on your way out, but that's not the case. So you have to have someone that can bring you there, stay with you the whole time, and then leave with you. So that's a big ask of patients. And so even though we have the good data, doctors know it, patients know it, it's still difficult to execute to get them to come in because it's not a quick process. We know from our dry AMD patient population, those who are at risk for developing wet AMD and then needing these injections, that those patients are very good at coming in twice a year, 3 times a year sometimes. And it's not because they're getting some sort of rewarding visual outcome by coming back. They're coming back just to check on the status of their disease. So, you know, even it's one thing to come back for just a checkup. It's another thing to come in also knowing that you might get a shot, which is not the most pleasant thing in the world for most patients to go through. So the adherence to those, you know, once a year, twice a year type follow-up visits is pretty good. So that's number one. Number two, The dosing of some of these future therapies may be twice a year. They probably will last longer than every 6 months. So even if the patient goes a little bit longer, it may not necessarily be putting them at greater risk because the drugs may still be having a positive effect on their vision. For the current therapies, which are relatively short acting but effective when used really regularly, there is a risk for that patients could have not just a slight setback in their vision, it could be a catastrophic setback. Fortunately, that's relatively rare. Usually when patients start sort of their disease starts reactivating because of a missed appointment or two missed appointments. It's more of a gradual onset of the disease returning. But it's hard for us to know which patient's going to have the gradual onset, which one's going to have a catastrophic point of no return onset. And so we try to err on the side of not allowing that to happen by recommending quite frequent injections. But the pipeline is strong with long-lasting drug candidates. We just have to get them in our hands, hopefully in the next 12 to 24 months or so.